choices.
Well, as long as we've sort of introduced the topic of health care, I think let's go with that. We have a viewer who's concerned about the high cost of health care, particularly for startup businesses, and is wondering what, if anything, the legislature might be doing about that this session. That's, of course, just a piece of a much larger topic, including access questions, cost, and what we might look like. Let's start with you, Representative Dean, since you sit on that committee, and then we'll free for all have an opportunity to talk about it.
Sure. The inability for Minnesotans to find affordable health care that they can actually pay for that works for their families has been increasingly difficult over the last several years. People complain they pay more and more, they get less and less, they can't get into their doctor, they have to travel further to get back into network. You might have to go through 2 or 3 towns to get to a hospital or clinic back in network. We see a lot of this happening faster and faster. So it's not just a rural problem, it's not just a middle class problem, it's not a private versus public problem, it's really a statewide issue, and it's one that we've been trying to address. We have tried to stabilize the individual market by pumping lots and lots of money into the private market in the last couple of years, about $700 million within 2 bills, just to try to prop up the flagging insurance business in Minnesota. That's luckily stabilized, but we were very, very concerned about that long term. The governor will have a program that says we should put more people on public programs to try to stabilize that. Obviously, the other side is to say what we really need is we need more people in the private market, not less, with more choices to try to balance that out. Those are the 2 arguments that you're going to see play out both nationally and at the state level, along with a lot of political stuff that will muddy the waters. But suffice it to say that if it was easy, they would have fixed it before the last election federally. And I think what you see with the inability for Congress to eliminate Obamacare in any way, shape, or form after many, many attempts shows just how difficult a job that is at the federal level and at the state level. So it's a very, very complicated problem. It's a tough one. It's one that I wish they would have had a little bit more courage in tackling at the federal level, because if you set that aside and say we're going to do tax cuts instead, that's not as difficult a job as actually getting at spending in something like health care.
Representative Bly, your thoughts?
Well, I'm an advocate and House author of the single-payer health care bill that John Marty carries in the Senate. And I think we could solve a lot of those problems if we had a program like that. It essentially is like if we could have Medicare for all. You know, if we could have a program where we had a single health insurance provider and didn't have all of the competition that I think gets in the way. I mean, a lot of times we talk about competition creating choice and bringing down prices. I don't think that's really workable in the health insurance market. And I think because ultimately what you end up doing is providing less for people rather than more to make it cheaper. And I think the answer for a Medicare type program or for a single payer system is that you ask folks who can pay more to keep the system going, and you make sure that everyone is covered, everyone has access to the health care that they need. And unfortunately, I think because our political system in this country is heavily influenced by corporate interests, and the health insurance corporations don't want that to happen. They don't want to let us move in that direction. And it is a philosophical difference among the parties and the various political influences we have, which make it difficult to move in a direction that could really solve that problem. But if you look around the world, you see other countries have been able to embrace this kind of approach, and it works well for them. I mean, I think they're able to. Scandinavian countries, for instance. It's interesting, the question asked was about small businesses, and I think especially in Scandinavian countries, but in other countries in the world, they look at this as a human right that people ought to have access to health care, and they find that small businesses, entrepreneurs are lifted up by that, having that access to health care and not having to go looking for it or pay for it in a different way. So I think there's a lot to be said for it.
Senator Bingham.
One thing I heard a lot from small businesses when I just came off the campaign trail was this is a huge concern for them because, small businesses want to do the right thing and give insurance, affordable insurance to their employees because they appreciate their employees because they understand that that's how they sell their product or provide their service. So I think allowing the public option buy-in is a good idea. The governor doesn't want to put people in it. He wants to offer them the option to do it. And I think creating that competition in the current market that we have now is a good thing. I think we have a lot of issues facing our society. And again, as a former county commissioner, I had a front row seat to this, whether it's the opioid epidemic, whether it's mental health crisis or addiction crisis. These types of things we have to work on and make sure that people have access to this, to programming and to services to help with these needs. And I believe it's, the state in partnership with the counties in how we work together on making sure that the people get the services they need. And I believe that ultimately will long-term help with some of our costs. But, the comments that, I'm not going to reiterate some of the comments that have been made, but, families are really struggling with the increased costs of health care and just pouring hundreds of millions of dollars to insurance companies without any guarantees of lower premium is not the answer. And so, we have to look at the quality of care and the access of care. I mean, you look at hospitals in rural Minnesota, a lot of them are the economic engine of a town. And so when you start messing around with who gets coverage and they start closing down clinics and they start closing down hospitals because they don't have the ability to provide those services anymore. And so you have you got to keep, working with, our, hospitals and our counties and making sure that we're able to provide these services for them.
Dr. Jensen, Senator Jensen.
Thank you, sir. The problems are so vast. I think that we can start with physicians. Physicians' default mechanism is to generally order more tests and to try to ascertain with as much precision as we can. I think sometimes patients think that that's a good thing because more tests make it sound like better care, so you get that going. And we have pharmaceutical companies that are extremely good at marketing their wares. So all of a sudden the patient is getting a message that, one, more tests is good, two, more drugs are good. And if you actually look at how we compare internationally, the fact of the matter is we use most of the drugs. We certainly use most of the narcotics. Somewhere along the line we lost a real key piece, and that was the patient believing in themselves. I think that if we want common sense to come back into the healthcare field, I don't think we're going to get it as much from physicians because we're going to continue to do what we do. We're intellectually stimulated and we like to do the lab sort of experiment. If the patient's blood pressure is this, if we lower it a little bit more, would that end up resulting in less cardiac disease? I think that patients need to know that they can and should be their own best champion, and they should be encouraged to do so. I think access is important. I think that even at the university levels, we have lots and lots of medical studies coming down and say, well, you should have this. I always thought one of the funniest one was if you go on a statin drug, and it does have the potential to cause diabetes, type 2 diabetes, if you go on a statin drug and have the misfortune of developing type 2 diabetes, the medical recommendation is don't stop the statin drug because now that you have diabetes, you should increase it because your cholesterol levels should be dropped even lower, which seems sort of silly. I mean, if something caused a problem, maybe we should stop it and see if the problem goes away. But we do a lot of that kind of thing. So I think that's a part of it. I do think that in terms of a single payer, I resist that just because I think we're going to have some of the same problems that these other places have. If it were easy, I think California, which was more than halfway there, might have gone on with it. But I think California has 40 million people in that state. And when they actually did the numbers, it was going to cost something like, I think, was it $40 billion? I think it was it $40 billion? It was just a huge number, and they could not do it. I may not have the math quite right, but it just didn't work, so they bailed on it. So I don't think it's going to be an easy fix that way either.
One other thing I forgot that you mentioned something that triggered my memory on this, but if folks don't have coverage and if the Affordable Care Act keeps getting chipped away at, folks are going to just go back to the emergency rooms and get treatments for things that it's not the most cost-effective or, the best practice on how to give someone medical services. So, we have to keep that in mind too, as we're going forward and looking at how we lower healthcare costs, but also expand access to people. More people are it just came out a couple months ago or a month ago that more people have lost their coverage, and that's not something that I think we want to have that trend continuing. So we got to make sure that people are having affordable access to the health care.